I've got Heath back on the podcast. I interviewed Heath Williams back in March 2018. It's hard to believe how quickly time goes on episode 13, but Heath is a rehab specialist and an osteopath who operates out of Melbourne, but Heath has a strength and conditioning background as well, which is unique, and part of the reason why I like speaking to Heath is a bit into the strength and conditioning, not just the rehab side of things, and bridges the gap. So welcome, Heath, back on the podcast.
Thanks, Adam. Great to be here, mate. Looking forward to having a chat for the next sort of, half hour, an hour or so.
Yeah, awesome. So just for listeners that might not have tuned in for that first interview that we did, can you just give us a little bit of a snapshot of your career and perhaps what you currently do and specialise in?
Yep, no worries. So I suppose if I think about what we're doing currently, I am an osteopath working in private practice traditionally, and we're sort of seeing clients typically coming in for musculoskeletal complaints, and that'll be your typical sort of office worker, but also your amateur athlete who is looking to either return from an injury and get back to their sort of particular sport, or for many others, if they've just got health and wellbeing goals, how do we become better? And that sort of obviously encompasses the physical side of it primarily, but obviously we're tapping into how their life and how they're living and stuff. And then on the side of that, just have another little business in terms of running occupational health and safety aspects and corporate work health and being. And so we're sort of really sort of traditionally, up until obviously this coronavirus sort of thing had impacted, was getting into the office workspaces and educating workers face to face. But like many of these different businesses, we've had to pivot in the last 2 weeks here in Melbourne, particularly because of this sort of horrible situation, which has meant that we've had to now move a lot of stuff online so that we can still be of help to all of our clients. And then I suppose the benefit of that is that we can now obviously help clients that are not just in Melbourne too. So I'm trying to see the positives in lots of these things at the moment.
Yeah, and then with your practice, are you guys still? So I know in Dubai we're pretty much like gyms, everything is shut. You can't even see like massage therapists or your rehab specialists here. Are you guys able to do face to face at the moment, or no?
According to the government at this point in time, yes. So obviously all gyms are closed and that sort of stuff here, but if you're a primary healthcare practitioner, be it a physio, osteopath, chiropractor, we can still. Obviously we're needing to be particular about triaging those. The idea being that if we're open, then we can ease the burden on the GPs for those perhaps acute patients that would typically present to the GPs when they're under the pump at the moment. So yes, in essence, but we're in that stage where I think we're not sure day to day at the moment from the messaging that's coming out.
Yeah, and then just touching on your strength and conditioning background. Now I know you've done a lot of strength and conditioning courses. How did you you're kind of into the rehab thing, and it's not usual that you see an osteopath that's into, well, I don't know a lot of rehab guys that are heavily into the strength and conditioning side of things. How did you sort of get your start, and I guess how do you combine those two modalities together?
Yeah, so probably like most people, it was experiential to start with. I bought my first book, which is Arnie's bodybuilding book at 14. Loved exercise, started doing that stuff myself, went down that pathway of traditional bodybuilding, that sort of training methodology anyway, as someone in their early 20s, and then evolved in terms of my thinking and exposure to sort of seeing other practitioners and other professionals, whilst also having had some of my own injuries, I needed to evolve my training. So since then, I've just sort of been on a path of always learning, and if I can learn from anyone and everyone around you, and that's my goal these days, is try to obviously learn from everyone. You can take something key there, and then how do I then sort of take that and implement that into my practice with myself, but also my clients?
Yeah. Yeah. Oh, it's good to see. So in terms of, obviously, with the coronavirus at the moment and you being limited in terms of what you can do, what if you're getting a referral and say you've got a new patient now, do you do like initially maybe the consult online with them? Is there ways around I guess the rehab side of things that you don't have to do? I mean, obviously there's always times where you need to do manual therapy, but are there ways you can sort of problem solve that?
Of course, yeah. So we've just launched that telehealth here, and pretty much so is every other allied health practitioner. And from a musculoskeletal injury point of view, we can do a detailed case history. We can obviously have the individual undertake a bunch of active movements that we can get them to do. So you can actually visually assess that person, and that will give us quite a meaningful sort of meaningful information that will allow us to sort of come up with a provisional working diagnosis. And then if we need to refer out, we can probably take it referring out at that point, whether it be the GP, or if it's looking like musculoskeletal stuff, then we can, and it comes down to training history and background around movement and that sort of stuff. But if they've got a good amount, we can obviously prescribe exercise as well as good treatment and management advice around how they can sort of manage that complaint at that point in time, and then create a pathway for them to get back to where their goals are.
Yeah, yeah. And so people are able to, like, say, bulk bill or use their health insurance on that side of things as well, or for the telehealth, or not?
So at the moment, it's previously up until sort of this week, it's been no if you've got private health insurance. But just this week, the Physio Association has released information to say that the private health, they'll be able to rebate for that under certain criteria, and I'm assuming that the osteopaths and chiropractors are going to be following with that. If it comes to a compensation-based patient, so you've had a road accident or a work-related injury, that can also be negotiated with those particular insurers around that. So it's evolving quickly, and I think we're going to probably see with this virus and the impact that it's had on business that we're probably going to see in 6 to 8 weeks all of those things that you could previously do in person, you could probably do over telehealth. Yeah, that's obviously my opinion, and I suspect that's where it's going to go.
Yeah, and then in terms of like just maybe a case study or someone that you've worked with online, and how it's actually how you've problem solved without actually being in person. Do you have any people at the moment, or someone that you've seen over the last few weeks that you've been able to actually, identify whether it's a postural issue? If you could just talk about that, just so we can understand how that works.
Okay, so I initially had a patient probably 3 weeks ago who's a CrossFitter, came in with low back pain. We got to do that one-on-one consult, and then obviously all of these issues have come about. So we've developed a program. They've got good movement literacy, so they know what they're doing from an exercise point of view. But they're now adhering to this program and taking regular videos and updating me with those videos, and we can then, we actually just using the likes of, say, Instagram Messenger and reviewing those videos he's submitting, we can then make changes to technique in terms of obviously modifications to the exercise load and things that are specific to his complaint. So that's been actually really helpful. And then I suppose from a work-related one, just this week I had a friend and colleague who is having ongoing neck-related issues. We did a teleconference consultation with him. He completed out some forms before he came, before we had the consultation. We reviewed that, and then we had the consultation. We've been able to make changes through him purchasing some equipment, which has now alleviated a vast majority of his neck pain. So we've been able to do some great things, be at work or actually in a training sense. So that's been really positive to sort of suggest that this process moving forward can be useful for certain clients and presentations. Yeah,
well, that's awesome, because I mean it also gives you the opportunity to upskill your skills, and you sort of refine your skill set, because you're able to, you're confined by these constraints of not being able to see someone, and then you're like, all of a sudden you're looking at them, whether it's on Instagram Messenger or whatever it is, and then all of a sudden you're able to, your market opens up. It's not just the people that can come in and see you face to face.
And the benefit being, I suppose, if you've got an injury that's not just sort of getting anywhere, you could probably now tap into experts all over the world and get a second opinion. And so for someone who, if you want to see the likes of, say, Stuart McGill in Canada on back pain, no, you could probably now have this telehealth type consultation, and providing you could afford for his consultation, you could obviously have him look at you and provide some meaningful information, which would be amazing.
Yeah, well, I'm tipping his hourly rates not too cheap.
No, I suspect, we might have to work a few days to be able to pay for that.
So, with regards to being online, what do you use for your telehealth conferencing? And then I guess the back end to that question as well would be like the social media side of things, which I guess we can get into. But just because we have a lot of like coaches and practitioners that listen to the podcast, and what has worked good just in terms of the platforms for you to get feedback.
I suppose to give these guys a promotion, my whole practice management system's with Clinico. That's an Australian-based software program. They've just launched telehealth, and that's secure. So I'll be using that moving forward for private private patients. But for the corporate setting, or for the person where confidentiality is not as tight, I'd be looking at sort of like we've been using Zoom, Skype, Microsoft Teams. And it's sort of been dependent upon what works best, even FaceTime and that sort of stuff on the iPhone. We've just been going with that. Whatever they've got, we'll use. Yeah.
Okay, cool. And then in terms of social media and promotion, so obviously you pivoting now online, and I know you're quite prolific in terms of sharing content, not just yourself, but also your staff. I think I've seen a few articles posted on your website, or you sharing on social media. What avenues do you guys use in terms of social media and I guess engaging with
engaging?
Yeah.
Yep. I suppose that we would use two main ones. So if it's looking at exercise and rehab and strength and conditioning and those patient groups or that, we're going down that sort of Instagram, Facebook, and webpage sort of pathway. And if we're looking at the corporate sort of client or corporate business, we're looking at LinkedIn and YouTube and integrating information into the webpage that way.
Yeah. And then do you have like a regular schedule in terms of for the content you're putting up? In terms of, do you have like, say, Monday you're doing this post, Tuesday this day?
Yep, so we post every day. So our goal is to post something every day and be consistent with that. And it needs to align with obviously what our business is trying to do and be the best at. And that, in a clinical sense, is obviously strength and conditioning, exercise, rehab, and also ergonomics. So they're the things that we focus on because that's our sort of, I suppose, specialty, even though we can't necessarily say we're specialists at that in Australia.
Yeah. And then is that more communication for your existing people that come into the clinic, or is that, I guess, more promotional? Does it help in terms of driving new sales and people engaging with your business?
Yeah, I'd probably say both, to be honest. Like existing clients, and obviously with coronavirus going on now, it's been actually really helpful for a lot of our existing clients that can't get to us, either as an inspirational component or perhaps a way to share a program that they could do at home at the moment. And then in terms of, say, engaging new clients, I think it's part of that. It's one of those touch points that leads to a patient making a decision to want to book in, and it gives probably them a good idea or a good way to sort of get in and get a sense of what we're about as a practitioner, but also as a business and our focus. And that might help, I hope in many ways, perhaps give us a little bit of credibility to say, well, this is who we are and this is what we do. So I think it sort of does both, and our goal is not trying to do one or the other. It's just get information that's out there that's useful and meaningful, and then if it helps lead to clients, then great.
Yeah. I mean, it's hard sometimes to cut through the clutter because there's so many people posting stuff online. It's like it's and I think once you have a reputation, I think you guys obviously being in business, for so many years, I think it's you get a bit of a loyal following, and you get that content out there with social media, and I guess this is like. Interesting for me as well, but for other practitioners and strength coaches. But social media, do you use to drive new contact points, new sales? Do you use social media advertising at all, or paid campaigns to get people in the door, or not?
No, not really, to be honest. The only thing we've invested in from a marketing point of view is on SEO for our webpage. Outside of that, we've not gone down that pathway. However, I know a lot of businesses do in that sort of space. And I suppose for us, that has not been a key focus point, really. I sort of think about if I'm on Facebook, I'm on there because I'm in my chilled out, relaxing sort of stage. I don't want to be having ads popping up in my face because that's my time. And I feel like if that was the case, I'd probably get annoyed by that, and I do, and that sort of annoys me in that sense. So I take that approach.
Yeah, well, I guess the best referral network is just to be good at your job. So I get most of your business would be through referrals, and I guess if you do a good job,
typically word of mouth.
Yeah, and I think it's probably smart from your perspective, is because you do have that strength and conditioning side of things. You get a lot of personal trainers and coaches like myself who follow you, and then you tap into their network in terms of their clients.
Yep. Yeah, and for me, it's not about stealing a client. It's about working with that person if they refer, and thus having a team around that person that needs help then. Because I'm good at certain things, and the likes of you are much better at other things. Two of us together are hopefully going to have a better outcome than just one. Yeah,
and I'd highly recommend working with someone like yourself, because just from my perspective as well, as you get someone that I might miss things in terms of my movement screen that I do. So I used to do a lot of FMS movement screens. I probably don't actually do much personal training anymore with the business that we're running. But when I'd refer out to you, then you'd pick up things that I'd missed in the screen, because obviously you do a more depth movement screen. And then for me, the plus side, and for a coach or a personal trainer working with the likes of yourself, is you get the ability to learn from you, and then you communicate. And then I've seen the emails that you send me quite in depth, and say this person, patient X, has limited thoracic rotation, needs to do this, and then you as a coach, you can start to learn off your skill set, which I've found is awesome.
Yep, and to be honest with you, mate, vice versa, in terms of when I'm working with you and others, I'm learning from you guys, because we've all, what you prescribe and how you go about coaching that and that sort of stuff, and the feedback that you get back from the clients, that's all part of the process of learning, isn't it? So it's good because it's fun and it's enjoyable, and you're helping someone, isn't it? Yeah, and it's a two-way street, because you're communicating, and then provided the coach is communicating back, then you can start to see. And then what I've found, when you refer out to a rehab specialist, rather than trying to wear all the hats of a strength and conditioning coach or rehab specialist, you get a little bit more trust with the client, because you say, okay, this is not my area of expertise. You go to see someone who is proficient in that area, and then the client comes back, and they're like, all of a sudden you've fixed the issue, and then they're feeling better about it. And so I think that's a bonus of working with someone like that. Totally. I think that's a mindset of a person, isn't it? Sort of, you either keep that person and keep them for yourself, or you look at sort of sharing around and looking for the best people to help them out. And that's sort of more of a patient-centered approach versus a personal-centered or business-centered approach. Yeah. And that patient-centered approach wins every day of the week. Yeah. Because of that outcomes for the individual, but you're also learning constantly, and we're getting the best around them. It's amazing, that approach, and that's, I think, I see people operating in silos all the time, and I think that's problematic in terms of that's going to stall someone's development. Yeah,
and then it also extends, if you're doing a good job. So, for example, if I'm a personal trainer and I'm referring you, 5 or 6 people, whatever it is, and then you know that personal trainer is doing a good job with their programming or the people that you're seeing, then you're going to scratch the personal trainer's back. You're going to refer, people back to them.
Always.
Yeah. So it's a two-way street. And I think a lot of people get in that mindset, as you said, you working in silos. It's like you're trying to solve all these issues. And it's like, man, you don't have to, it actually makes your job so much easier, because then you don't have to worry about going on YouTube and trying to educate yourself on that area. You can do what you're good at.
Yeah, that's right. It's probably, I don't know what it comes back to. Maybe it's ego, or maybe it's sort of like just not being immature as a professional in that space, or I don't know what it is, but hopefully, we sort of move through that stuff. And as you say, everyone starts to develop this team approach. Yeah.
Absolutely. So with people not being able to attend gyms and not being able to do, say, their usual programs, whether it's with a personal trainer, and they're stuck at home with minimal equipment or programs to use, what do people need to think about when programming? I know you did a Instagram, I think it was Instagram or maybe a Facebook post on programming, and what people need to think about when looking at being at home.
Yeah, so I suppose it comes down to, because I was chatting to an osteopathic colleague about this, I thought, you know what, with everyone being housebound now, what are going to be the injuries we're going to see in the next 6 to 8 weeks? And that's where that post came from. Because people probably, unlike yourself and me, who probably have a spare bedroom full of gym gear and that sort of stuff, because we've been collecting it. But if they don't, they're going to just go to body weight stuff, or they're going to go to plyometrics, or they're going to go to sort of interval type or circuit, high intensity stuff that perhaps their body's not conditioned for. So I suppose it comes down to how regularly have you been training before this occurred? What were you training for? And what did that training look like? And I suppose we don't want to, if you weren't ever training before this and now you're like wanting to train, then obviously coming up with a simple program and having graded exposure to that activity and exercise and allowing for appropriate recovery is the key. But if you've been like some of my mates, they're all generally heavy powerlifters and that sort of stuff. So apart from them jumping on the local Lion Edge webpage and trying to buy everything before it gets sold out, they're sort of like in this space of probably detraining at the moment.
Yeah.
And if I think about what they could do, it's probably more, you could probably treat it as an opportunity to deload, or perhaps focus on some of your weak points, and weak points might well be mobility and flexibility, or it could be looking at sort of other training methods of looking at time under tension or isometrics, things that perhaps your space and equipment that you do have allows you to do.
Yeah.
So that's what I'm sort of, every person, so I suppose the advice I give is it's all around context for that that individual.
Yeah.
And that sort of stuff. So, does that make sense?
Yeah, absolutely. So, I mean, just to dig deeper on that, in terms of, I think, especially with a lot of our clients that we see here, it's Gen Pop, people that are working, 9-to-5 job, not necessarily a powerlifter, but I'd be interested to hear your thoughts on that. But, so, for someone who is, perhaps just looking at it as an opportunity to get moving, and then you spoke about, I think in your post, about people overuse injuries. So for example, if they're doing a lot of push-ups, dips, and they're obviously not getting a lot of the balancing it out with the pull aspects of the movements, what could they do, just from a general sense? I know it's hard to generalize because everyone's unique, but if you're trying to create a balanced program for someone to do at home, if you're talking about general pop, usually obviously people with tight anterior hips, forward head posture, limited T-spine extension or rotation, I think that's I don't know, from my point of view, that's probably the general pop. The key ones. What would your advice or program look like for someone like that?
Yeah, okay. So I'm just thinking out loud here, but so just say a person's used to training 3 to 4 times a week and they're now home all the time.
Yeah.
But there's no reason why they can't move every day. So there needs to be some degree of movement. And I'd be looking at, say, some type of resistance training. And if they've got a history in that space, 3 or 4 times in that week, if they can.
Yep.
And then we'll talk a bit more about that in a second. But outside of that, it'll be obviously on those off days, can they be walking? Just to get the body moving in that sense. And then obviously with the likes of the internet and that sort of stuff, right now I had my kids doing Cosmic Kids Yoga yesterday. So we can be tuning and tapping into perhaps sort of other aspects of training like yoga or mat Pilates with all these businesses now offering their classes online via Facebook and Zoom that might be looking at that mobility and body weight control stuff. So firstly, what is it you like to do? And then let's focus on that stuff. If it's resistance training and it's you can only do something twice a week, I'm looking at full body. So integrating all those movement patterns twice a week, be it squat, hinge, lunge, push, pull, in sort of relative to what equipment we have around us. And that might be a chair, that might be some bands if you're lucky, it might be a dumbbell if you're lucky again. And how I'd be looking at that is I suppose we'd have the same movement patterns trained each program, but we'd be looking at perhaps alternating how that exercise is done to create a different stimulus on the second workout. So you're not just necessarily doing push-ups each workout. It might be push-ups one day, and then the next day it could be banded, maybe chest press or banded cable flies, etc. So you're getting a different stimulus. Same thing with, say, squats, for example. It might be one of the sessions might be more of a goblet squat hold, and then I suppose if I'm thinking about an alternate version, we might go for more of a hip dominant box squat, so that we're sort of still looking at the pattern, but we're getting some change in how it's done. Same thing with a deadlift or a Romanian deadlift, or like a split squat and then a single leg RDL. How do we sort of have bilateral and single leg stuff in their program? So I suppose we want to, if you're only training twice a week, incorporate movements that might be some horizontal push, which could be a push-up, or a chest press with the band. If we're looking at horizontal rows, it could be a dumbbell row, or perhaps a bent over dumbbell row, or a seated seated banded row, or a TRX bodyweight row. If we're looking at squats, looking at some sort of either bodyweight squat or some sort of loaded squat. And where we can vary things there are obviously stance, so we can have a conventional stance or a sumo stance just to get a different stimulus. If we're looking at hinging, looking at perhaps a deadlift, or more of a strict stiff leg deadlift like Romanian deadlift. And then again, if we're looking at, say, overhead vertical push-pull movements, can we get some banded pull movements or straight arm pull-down movement, and then some sort of overhead push movement, and that sort of stuff. So integrating all of that stuff if we're training twice a week. But if we're able to train 3 or 4 times in the week, I'd probably look at splitting things up a bit. And I suppose that comes down to what's our goal. So it's Gen Pop, and Gen Pop is just get the body moving, train each body part, and it's more in a maintenance phase. What can we do in a set period of time if we've got 30 minutes, or say 45 or 60? How do we then structure that sort of training to fit within that time? But also, you might have one particular session where we're working in a circuit-based session, and then the other session might be perhaps more time under tension, slow tempos. So they're working harder, and we're moving them perhaps from, say, a lower body dominant exercise to an upper body, so the rest breaks occur within the structure of the program. Yeah,
absolutely. That's awesome. I think in terms of with people having more time at home, they're probably looking to train probably more frequently maybe than they perhaps have. And that's what we're experiencing with a lot of our clients, is just, boredom. They're at home, they used to be traveling to work, 30 minutes, 40 minutes each way a day. So they're getting back a lot of time. So they're looking for things to do. And particularly, training, because they don't want to necessarily be sitting on the couch just watching Netflix all day. So it's good from our point of view, because we do have a lot of people asking us, what can we do? What are the next steps? How can we stay active? So we're trying to constantly, upskill and try and give them the best information, what they can do. So all that programming stuff is great. But in terms of what in your practice, so when you see a general pop client, maybe they're active, they're going to the gym maybe 3 to 4 times a week. What are the most common mobility drills that you prescribe in your business? And I guess that can give us a bit of an insight into what perhaps we need to start looking at.
Okay, so it'll be three key areas. We're chasing the foot and ankle, or ankle. We're looking at the hip, and then we're looking at that thoracic spine shoulder girdle. So ultimately, not just thinking sagittal plane forward and back, but side to side and rotary sort of movements. So thoracic spine needs to extend, needs to rotate, needs to side bend. So I'd have a few exercises there that focus on, you could have cat-cows that are more localized thoracic flexion extension movements. We can move into a range of, say, hand-on-head drills to be doing rotary sort of stuff, and that can be done on the ground, 3 points, or it can be done standing. And then when it comes to the hip, same thing. Hip needs to extend, hip needs to adduct and abduct and rotate. So chasing all those movements around the hip, looking at the glutes, the hip flexors, the adductors, hamstring group. So looking at those, and I suppose the assessment will drive what you prescribe. So for some people, they don't need a hamstring stretch because they've got great active straight leg raise movements. But traditionally speaking, at the hips, it's going to be normally your hip flexors and hamstrings that we're going to chase, and then obviously glutes and that sort of stuff. And then obviously ankle, we get lots of people coming in with that sort of stiff ankle, so needle wall driving movements and that stuff. They're the three big rocks, I suppose, that I would chase in everyone as part of movement prep for training or just general well-being. Yeah,
and so with the so they're tied at, say, the hip, anterior aspect of the hip, which ones are you prescribing? Is giving them a couch stretch? Are you giving them more an active one, or?
I suppose I'll start with the static stretch if they're not used to doing lots of stretching. Engage with that and do some long duration holds, but it could be sort of minute to minute 30 regularly. But once they've started to work through that, then once we've achieved range, we now need to actually create mobility. So how do we then create sort of control through range? And it'll become more of a dynamic one, which could turn into a dynamic kneeling hip flexor stretch using perhaps just the body moving, or it could turn into a lunge with an overhead reach, which is going to create obviously a nice eccentric stretch through that hip flexors and abdominals on that rear leg. So it'll be relative to the person, their history, what they're capable of, what their body's showing me, but it's going typically from static and then moving that through to controlled mobility or dynamic movements.
Yeah, and then just to close the loop on that, what's probably your most common prescribed for, like, to say, the shoulder girdle? So we've gone through, obviously, ankle and the foot with the knee drive forward, and then you've got, say, the anterior aspect of the hip, which we just touched on then, and then just to close it off, the shoulder. What are the common drills for the upper body
drills? Yeah, I suppose with all your T-spine stuff, your shoulder's integrating into it, but probably some of my go-tos these days for shoulder itself, I quite like hanging if that person doesn't have any pain in that overhead position. I think hanging's quite a nice one to I suppose distract that joint. And then obviously opening up through the chest, through the pecs, and the lats are probably my other go-tos. I generally stay away from any across the body impingement type stretching for that posterior cuff, because I think that can irritate the shoulder. I'll also stay away from some of those CrossFit banded ones with hand behind the back, because I think those things, they're extreme end range points that will stir up most people's shoulders if they're because we don't need that movement because we're not doing that often anyway. So just chasing flexion, chasing external rotation at 90 degrees, and that means hitting pecs, lats, and then obviously a bit of distraction in the shoulder joint. Yeah,
with the distraction in the shoulder joint, with like the hangs, what are you looking at? Sort of 90 seconds, or what are you? What are you
if they can hang for 90, they've got a good grip strength. Traditionally speaking, it might well be it might start with a partial hang, so hands overhead, but then just dropping the weight but keeping foot contact. So they're getting a gentle stretch. But if they don't have anything to hang vertically, can they do it in a doorway and then obviously flex into a hinge position and lean back to get a bit of a distraction and a lat stretch that way? That'll be my go-tos on that stuff, assuming it's not an irritant in that position.
Yeah, and then you could possibly use like a band for that as well if you had bands.
Band's awesome. Yep, and then if they can be moving their body around to fish around and find that point of tension, that's a nice way to sort of explore that mobility and see where things are tight, because obviously the tissues don't just attach in one point, they wrap around things, so we need to sort of fish around to find that.
Yeah, and then with your if you're programming for say someone and that was their issues, they needed to do those, is that more of like a daily thing, or would you get them to do that like as a prehab? Are they doing that prior to the strength training that they're about to do, or is the frequency a little bit more?
Yep. So if person doesn't have requisite mobility and flexibility there, that could be daily, if not more, and that might be all they're given until we get to that point of then being able to load that movement a bit to then build that strength and mobility. But if we're doing regular training, that'll form part of that movement prep. So, like for some, you might adopt that roll, stretch, actively move, and then do your weight training. I've probably moved away a bit from the rolling type of stuff and just moved to more either static or perhaps more mobility work and then exercise. Just preparing the body for movement, and that means doing the things or getting those areas ready for the things you're about to do. Yeah.
And then you did, just touching on, you said you don't do the roll. Are you talking about like the segmental roll on the ground, or just the floor stuff?
More so your foam rolling sort of stuff. Moving more away from that direct sort of panel beating approach. Just because I suppose it might feel nice, but do we change anything when we do that? That's probably the question I keep asking myself.
Yeah, so with that sort of panel beating work, I mean, it's huge. It's been huge for a long time in terms of foam rolling, but I think probably in the last two or so years, or maybe less than 2 years, you see a lot of those massage guns, like the Hypervolt. And you see a lot of in the gyms that we go to over here, you see a lot of trainers just literally just destroying someone with one of those Hypervolts before a session. Can you just touch on that, what it does, and if there's any benefit to it? Because you see a lot of people using them and they don't. I hazard to guess that they don't have no idea what they're doing. They're just kind of like throwing it in there.
Yep. So you've got me on the spot, Ian. So pain science, I wouldn't say I'm an expert at, but I've got a pretty good approach. They think they're getting in and releasing the tissues, and so I think I don't think that's necessarily happening. But what I think when someone does that, we're actually having an effect on the skin and the tissues, and then how the body perceives that sort of sensory input, and then that can obviously that connects back to the brain and that sort of stuff. So I don't necessarily think we're getting this loosening off of the tissues. I think it's more of a neuro sort of sensory change there. I think people sort of see these things on social media, and they see a few people that are, I suppose, social influencers, and they think and they correlate this and pain with being a good outcome. And for them to have great performance, they've got to do the same as what they see there. So it's a lot of copy and do. And genuinely speaking, I think there'll be limited evidence around this stuff. It's just that the marketing kicks ass at it. And give a few CrossFit people that and that sort of stuff, and all of a sudden everyone's got one, and they're making their own with their own stuff from the local Bunnings shop and that sort of stuff. So for me, I'm not into it, and I generally prescribe not to, because I think people that are chasing that, they associate pain with good outcomes, and the more pain and pressure that gives them, they get this sense of that's going to be better for them. But if you actually did a test and the test was, let's look at see if that changes range, you go, okay, range, let's panel beat that with a Theragun or something like that, and let's reevaluate range. I wonder if it's changed. That's the question, because I suppose that's ultimately why we're doing it, to try and have an influence on how it's moving, to then obviously help what we want to do after that.
Yeah, well, I mean, a lot of people,
Yeah.
I don't think they even know. They see it, and I can't see how
Get one.
Yeah, so how many times I've been on social media and I see a personal trainer put on the slow-mo on their phone, watching them
Yep.
dig it into their quads, and it's like...
So is that a time filler for that consult then? Or does the person sort of who's getting it go, do they actually do they get a good endorphin release from that? I don't know.
Yeah.
I've tried it, and for me personally, I don't see it being that useful. But I suppose maybe there's a big placebo effect to that. So if you're getting amazing placebo effects, is that the way to go? Who knows?
Yeah, well, I mean, sometimes placebo works on a lot of people. So if they believe it, then maybe they don't want to listen to this because they'll
That's
stop,
right.
It'll stop working on them.
Yeah.
It's
yeah. Go, sorry.
All good. So with people working from home now, can we just touch on your corporate work, Health Australia? I think is that your business?
Yeah, that's right.
Posting about that. Obviously, people sitting behind a desk in their home setup is going to be different to what they're used to being in the office, and what I think last time we spoke on the podcast, you talked a little bit about this, but I guess could you just touch on the importance of the setup and what you actually do with that?
Totally. I'll keep it really brief though. So in the last 2 weeks, everyone's been sent home from their work with a laptop. So most people don't have a formal workstation area. So let's just say you're going to be at the dining room table, dining room chair with a laptop. If you have nothing more than that, I want you to get a cushion, sit on the cushion on the dining room chair. I want you to get a cushion or a rolled up towel, support your low back. And if you can, get a keyboard and mouse and plug it into your laptop so you can push the laptop away, prop it up on some books. Now, that'll be the best way you can work with a laptop in isolation. However, it's not going to be perfect. So you need to get up and move. 2 minutes every 30 minutes, 10 to 15 minutes every 60 to 90 minutes, and you want to chunk your work day so you're not doing 8 hours straight, because that'll be problematic. If you're one of those lucky people that's been able to take, and I've got clients this last week who the office has allowed them to take their chair, their monitor home, their keyboard, their laptop, so they're taking everything home. So I did 8 teleconference home ergo assessments yesterday. Everyone had that stuff, but they're sitting on a dining room table. So effectively, optimize it as much as you can, but also know that it's not going to be perfect. So movement is key. Not throw in on top of that, I suppose everyone's now working at home and they've got kids, and you've got 2 parents potentially trying to work and have kids, and there's all this other stuff going on. So stress is high, and in order to manage stress, we need to have good sleep, you need to move, you need to eat well and exercise. And that's going to help you obviously maintain some sense of normality, but also hopefully and develop a routine around that is key. But ensuring that we manage that stress load that this period is for many people.
Yeah, well, that's good. Because I saw Tony's mug on your social media. He did a video, and I think he told me last time I spoke to him that you helped him with his neck and his home setup.
Yeah. That's right. So he was that person I was talking to before about changing stuff to help his neck. So I wish I had have assessed that many months ago, because now we probably could have assisted that much sooner.
Yeah, and then Tony's been obviously a podcast guest before, and I'm sure he wouldn't mind. What specifically in Tony's case was the setup issue, or was he just not getting up and stretching enough or moving around? What was it wasn't a movement thing, because Tony is like the most he's I suppose the most dedicated, committed to having good physical movement. It was his screen position. So he was sitting with his keyboard and mouse in front of him, and his screen off to the left side. So he's effectively required to either turn his head left and look at the screen, or if he turns his body to look at the screen, now he's developing an awkward typing position. So what we did is he just bought a monitor arm that he attached his monitor to. Now the screen sits bang in front, and
that's been a big game changer for him, because he does a lot of work at that home workstation, so that's been really helpful for him.
Yeah, it's interesting. I mean, it's just a small little setup thing can have a huge effect on someone, and obviously if you don't know what they're doing for 8, 9 hours, 10 hours a day, and you're coming in and Tony or whoever it is probably thinking, oh, it's what I'm doing at the gym or doing this, but it can be something as simple as that. Simple.
I assessed one lady once who had repetitive upper limb pain, say tennis elbow. She probably had 30 consults with an allied health practitioner. So if we multiply that by 100, that's $3,000. We went in and assessed that. We moved her mouse from the right side to the left side, made a few changes to a chair. In 6 weeks, things are much better. So I suppose if we take that work and where that person spends most of their time and what the triggers are, if we can change that, then maybe they don't need to have 30 consults with a health practitioner.
Yeah. And then I guess this are you open to seeing people from like online, like all parts of the world, or is it you?
Yep. Yeah, definitely. So I suppose the benefit of this telehealth consult stuff now is that we can do that stuff everywhere. So it'll be as simple as jumping on our website, which is corporateworkhealth.com.au, and you can book a ergonomic assessment, and you'll get one of us, myself or one of the physios or other osteopaths going through that process. And that's the same thing for an injury. If you need a second opinion and you've been getting treatment somewhere and you're like, okay, I wouldn't mind just getting a sense around that, and it's maybe exercise rehab or strength and conditioning related, then again, jump on our webpage, principle4osteopathy.com, and you can book a consult there, or just email me, and then we can have a bit of a chat that way, and perhaps have a chat like we are now, and sort of set something up and see whether or not you're going to be suitable for that sort of approach.
Yeah, awesome. Well, I'll put the website and I'm not sure if you want your email in there, but we'll put your links to your website.
Yeah, we can put that in there.
Yeah. And then, so if anyone's got any or wants to have a consult or reach out, they can get in contact with yourself, which is always good. And then, so I know I won't take too much more of your time, but I just wanted to touch on, because we spoke about it last time. I know you're an avid learner, always upskilling. What in the last perhaps 18 months or 12 months or 6 months or 6 weeks have you been focused on in your education or attended courses?
Yeah, I suppose since last time, recently I did, Stuart McGill was out here in Australia and had his symposium with Joel and Ed. So I attended a couple of days there. That was fantastic. Looking at low back pain and integrating from rehab to performance. So that was amazing. I've also spent some time with a psychologist, Helen Mentha, who runs motivational interviewing courses. And again, I sort of, that communication stuff's of real interest to me.
Yep.
And spent doing some deepened courses with her, and that space has been a big change. In terms of, say, personal learning outside of that professional sort of space, I suppose I've just been doing a few, I'm just trying to think about the podcast, not off the top of my head, none are coming to me, but generally it's podcasts, because that's the best time I get to listen to stuff.
Yeah.
I got a few Simon Sinek stuff recently, but I haven't started them yet.
Yeah. And then just in consuming content, so, I mean, obviously not on the course side of things, but you touch on just podcasts, YouTube. Do you have any, subscriptions that you sign up to?
Heaps of podcast subscriptions. I'm just going to pull it up and have a look now. So I think for me, podcast is great because it's digestible, 20 to 45 minutes. You can get in and out. You can pick to. So there's the Movement Fix podcast. You've got More Than Macros food podcast. Obviously Mike Reinold. You've got Tim Ferriss, Barbell Logic. The Perception and Action podcast. The Strength Coach podcast, all of those things I'm into. I've got heaps on here, and I'll be picking and choosing and getting through that stuff.
Yeah, and that's at the moment, that's what I've been missing, because at the moment we're in lockdown in Dubai. We're not, for the next 3 days, no one's supposed to go outside. So at the moment I'm sort of missing, I regularly
so you can't leave your room.
Yeah, so we can't, normally I do at least an hour or an hour and a half walk a day where I'll just go out and that was my time to consume a lot of like podcasts, and now I'm just like cooped up inside and I can't annoy my partner with just blaring podcasts at home. So I'm really looking forward to getting back to consuming some of that stuff. And in terms of video content, YouTube, is there maybe Instagram as well? Are there any accounts that
probably Instagram actually a lot. Yeah, like Instagram's a big one. Like obviously, I always like to see. There's probably a bunch of physios and osteos and chiros and strength coaches that I've sort of followed. I'm just trying to think of a couple here. You got, I think, the Athletes Authority or Lachlan Wilmot. I like his stuff. He puts up some good S&C content here. And then obviously Adam Meakin's been a physio, puts up some really challenging content there, but also interesting but challenging. I suppose our beliefs about why we do certain things. And there's a bunch on there, to be honest with you.
Yeah. All good. So what? I mean, this is probably be the last question. It's about what your current training looks like. So what are your? I know you're a sort of busy man and you're always, working. But what's your program at the moment now?
Yeah, I suppose. So I'm training at home, probably like yourself. I'll do some form of resistance training every day. It's always sub-maximal, and it'll be either I've got into the kinetic link training methodology, which is was designed by Wayne Rogers, who's a physio here. So looking at full body movement stuff, that's been really nice on my body because I'm pushing 40 this year, so I can train every day, but not necessarily put it under too much stress that powerlifting training and bodybuilding did. And then throw on top of that 3 to 4 because I had an injury to my knee, which meant that I couldn't run anymore, or I haven't been able to for a little while we go through the rehab process. So I suppose stretching and mobility most days, integrated with body weight or strength training, which involves TRX, body weight stuff, kettlebells, club bells, free weights, all that stuff that I've got at home, and then on the spin bike 3 to 4 times a week. Yeah.
Well, it's good to hear that you also get injured. It's not just us mere mortals.
Yeah, best way to learn is get injured.
Awesome. All right. Well, so finally, where can people get in contact? What's the best place to reach out to you? And then social media accounts. Where do they get information?
I suppose social media. If you can follow me. Yeah, if you can follow me on Instagram, Osteo Heath, Principal for Osteopathy. If you can post a link up, that way you can see what we're about. You can contact me on a message there, and that you can then I can point you in the direction of our businesses if you're interested in that. Otherwise, hopefully, I'll put some content that might be useful to some of the audience that are listening. And if not, just unfollow me.
Yeah. Awesome. All right. Well, thanks very much for taking the time today. Really appreciate it, and I think there's been some valuable information. So hopefully the listeners can get into it.
Cool. Thanks for having me on, Adam.